Hey y'all, I'm Amy Morgan. I am the marketing coordinator here for Pediatric Dental Associates and Orthodontics. And in today's video, we are going to be interviewing a mom who specifically comes to our practice. We're going to be getting into how well, hopefully, she thinks we take care of her family, but also we want to get really honed into one of her children, Jose, who is a special needs patient who has Angelman syndrome. And we are going to talk about everything that goes on with that and kind of give even you a testimonial about that, but also some advice for any of the moms out there who may be dealing with some of the same things with their special needs children. So getting into that, our guest today is Ms. Lorena De La Garza. Say hello, Lorena.
Hello.
And Lorena has had several children come through our practice, and so we're going to learn about Lorena here in just a second, and then we're going to get into some of that advice for our moms or dads of special needs patients. So Lorena, let's just start off. Just tell me a little bit about your family, like you and your family, kind of what y'all do for your jobs, and then your kids. And
Yes, so my name is Lorena De La Garza. I'm married. I've been married for 5 years now. My husband does concrete work, and we have 4 kids. We have a 19-year-old, 18-year-old, and a 10-year-old, and a 3-year-old. And wow. So yeah, we're a pretty busy family, but all of my children have been at the dental office, and they've had a great experience. So I'm excited to share that with you guys. But yes, we're pretty busy. My little one's, 3-year-old, she's going through the terrible threes, so she really keeps us on our toes. And then my 10-year-old, his name is Jose. He's special needs, so he does require a little bit more attention. And then, the teenagers, well, they're teenagers, they're grown-up adults now, so we hardly get to see them much at the house. They like to do a lot of things on their own.
Sure. Then that's completely understandable. And so all of them have been patients at PDAO. Just talk a little bit about just your general overall experience with like our practice, just yes. kind of how things go, like any kind of standout things you want to kind of let our audience know would be appreciated.
Yes. Well, the 18-year-old and 19-year-old are actually just went on their last appointment a couple weeks ago, and they actually are fixing to have to leave, which they are really sad to leave because they've been going there for quite some time now, and they've had a great experience. They actually even had their orthodontic work there done as well, so they're very familiar and they love it. My stepdaughter, she's the 19-year-old. She was like, oh my gosh, like I have to find a new dentist now. Like, she's like, it's kind of going to give me anxiety just have to leave to another place because she gets really comfortable. And she's very shy. So she, now that she's been going there at first, like I would go with her to her appointments or her dad would take her. But now it's like she goes on her own and she feels good about going on her own to her appointments. And now she's like, oh great, now I'm going to have to figure it out all over again, going somewhere new, but she's fine. She'll be okay. My special needs son, Jose, he has been going there since he turned 1. I mean, he's been going there for, all his life. And I'm glad that we got him, we got him into going into the dentist like frequently, and not only that, just following up with his checkups, but also like stopping by and visiting and just getting comfortable when the other kids go, because I feel like that has really helped. So when we first went to the first visit, we had to hold him down. He has like sensory. So Angelman syndrome is what he has. Angelman syndrome is a genetic disorder. It basically is very similar to autism. So he has sensory issues. He gets really panicked when there's like, if he's in like a large group or if he hears a lot of noises, like it all kind of makes him worry. And then when he worries, he really like gets on this where he gets it like, he starts on panic mode. Like he'll start either grabbing other people or like grabbing like scratching, or like he really loses it whenever he sees like a big crowd. Well, he's gotten so much better though. Like I feel like that was when we first started. Whenever he turned 1, I remember the day that he went in for just a cleanup and checkup, we had to hold him down and they had to use like the mouth prop, and everybody was like, there was like 4 people in the room just holding him because he wouldn't open his mouth and he was terribly afraid. So that was like our first visit. but to where we're at now, like it's so hard to believe that he will go in there by himself and like sit, open his mouth, follow instructions. He can get his teeth cleaned. He doesn't have to have a private room anymore. He can be around other children and he will not panic. Like he really does really well. And I think what has really helped is the frequent visits. And then we also have been trying to stick with the same doctor, the same assistant, just to kind of get him comfortable with seeing the same people. And he remembers. It's so funny because you think, my son, there may be some things that he struggles with because he's nonverbal, but he has a really good memory because when he goes in, like he'll remember the assistants and he'll try, he likes to hug or he likes to hold hands or he'll go up to the assistant and just, share some love. And he just, it's so different from when we first started to where we're at now. But I do see that it has tremendously helped that we stick to going there, not miss go every 6 months, your follow-ups. If you have a chance to take your children whenever other children are there, and you can, like Jose does well when he goes with other visits now. I think at the first time it probably would make me nervous to take both of them because taking a 2-year-old and my son would, but no, like he does so well now. I think he does better than my 2-year-old. My 2-year-old is the one that, but she does good, but she didn't at first either. But he does really well. I mean, I'm so proud of him for being that compliant and, just getting through with it. And still, like, he knows already that he gets rewarded for being well behaved. He gets a little treat. He knows when we walk in that there's games. So it's just the atmosphere itself makes it very welcoming for him. He loves going there. It's even if we drive by there, he already knows the building that he'll be like, and he knows exactly. So he does like hand signals and he uses his little iPad to communicate. So if we drive by there, he thinks that he's going there, and he gets mad if we don't. But it's just amazing how much it helps and how much you'll see the difference of sticking to that, of taking them and just even taking them on a tour, just whenever, if you don't have other children that go there, you just have a special needs, maybe just requesting to have a tour just to kind of get familiar with the place, because that really does help kids with not just Angelman, but with autism, because it's very similar, just getting them comfortable and familiar.
Yeah, I think that's great. I mean, my biggest thing is, I think you just spoke to a lot of moms in our area. There's a lot of families out here with special needs patients, and I think, or I should say special needs children, that a lot of times, even just, outside of understanding that the child is going to have these certain sensory issues and these reactions,
yes,
that it also, the parent is filled with that fear at the same time. And maybe even, I hate to use the word embarrassment because no one is like embarrassed of their child, but what I'm saying is like, they don't know how the dentist or the assistants are going
yes,
to treat the child, or how all that interaction is going to work. And so some of that fear may be keeping them from making those appointments. And can you speak to that a little bit as a mom?
Oh yes, 100%. I feel like us as parents, we feel maybe our kids are not even, probably they don't even have the fear, but we have the fear for them just because we don't know how it's going to go and how they get treated and how they'll respond. So and I don't know, I'm an overthinker, and I think this is me personally. I'm an overthinker, so I think about 100 different things, and especially with Jose. But honestly, I think that if you stick to, obviously ask your questions, like figure out, like, I know whenever I make his appointments, I'm like, can he stick to the same doctor? Can he see the same person? Can we go in there and and it helps that the assistants also show him like what they're going to put on his mouth, and not just like they talk to it. It's not like an appointment that's rushed. It's literally like, so like, they really take their time and like show him like, oh, we're going to turn on the TV. We're going to put a napkin on. And they don't just, cause that's important to them. They need to see what's going to happen before it gets done, or they'll, get on the panic mode. And then if he's on panic mode, we get on panic mode, and it just, but I feel like it's been a great experience because everything is well explained when you sit down. The assistants work well with with my son and explain what's going to happen. They explain to me what's, what the process is going to look like. And thankfully, I feel like right now we've never experienced like the first appointment was the one where he was freaking out just because he didn't know what to expect. And, I try to brush his teeth at home and it's kind of complicated sometimes. And I think every other mom that has a son with special needs may understand this, that it's not so easy to brush our kids' teeth. But I honestly think that if, like I said, and I'll probably say it a million times, like if you continue to stick to it, it helps, because even Jose now brushes his teeth. He doesn't do the best job, but he does it on his own. And we couldn't get a toothbrush in his mouth, and now he like brushes on his own. So it really helps to like sticking to a routine and continuing to like go by it, and then just, have the patience with your children. It helps and makes a tremendous, like you'll see a big difference from initially starting to where you're at now. And I feel like if you're struggling with like brushing your child's teeth with that, just, make it become a routine, and then start baby steps, like start slow. And then you'll see that they, by themselves, they'll really start to get encouraged by it. And before you know it, they'll be brushing on their own. So.
Yeah, I think we try to stress that a lot. I think even with, any child of any age, the brushing is always a struggle.
Yes.
And that consistency is key. Like we always try to talk about that, and we always try to really stress that in our educational programs. And when we go into schools and all that kind of thing, we're just saying like, make sure you're brushing, make sure you're brushing, make sure you're brushing. And it's not going to be perfect every single time. And I think I laugh because there'll be like sets of siblings like you're talking about, and you'll have a kid who doesn't brush their teeth.
Oh, yeah.
And they never get a cavity. And then you have the avid brusher who ends up with all the little cavities. And so a lot of that plays into like their diet and like all that kind of thing. So there are a lot of factors that play into that.
For sure.
When Eric and Leslie were in orthodontics, can you speak to a little bit about the collaboration of how we're able to put appointments together? Like we can see you for your cleaning and the orthodontic stuff all in the same thing.
Yes, that really helps to be able to do that, because they could schedule like a day for them to get wires taken out if treatment needs to be done. I know that Leslie had something where she had to get something done. They were able to get her wires out, get her treatment done, go back in, put her wires back in. So it was kind of nice to have that flexibility to be able to jump from one appointment to another and not have to leave the office. So I thought we really felt like that was very nice to be able to do that. It was really helpful.
And that's one reason why we added orthodontics, because we started seeing, we started orthodontics in 2009, and we started seeing that where we were having patients who had to come in and get a filling, but it was like not a complicated process, because we'll make anything work, but it's like we had to call the orthodontist. We had to make sure that they had the appointment to get the wires out or the bracket off or whatever they needed to do. And then they had to come to our office, have the treatment completed, and then drive back to the orthodontist office and have that. So
that's like a whole day.
Yeah. So it's like a whole, yeah, right. So I think the convenience factor of having both in-house is really good. And I think that we do a really good job of that. I know that Dr. Jason speaks a lot to the fact that he loves just having his dentist right there where he can just collaborate, talk about really like aesthetically if they're having anything cosmetic done, but they're able to like literally sit in the same office and talk about cases versus having to do things through email or over the phone. We still do that because we do have families who are established at their family practice and they want to come see Dr. Jason for ortho, and we can completely do that. It's still just perfectly fine for that. But if you're on like the cusp of thinking about starting orthodontics, that is one of the benefits of having it done in the same practice as you're having your dental care done. So I do think that that's super important. Like you said, it saves a lot of time.
It saves time. It's very
saves a lot of time, but you also end up with really great outcomes when you have that in-house like collaboration. So I know that Dr. Jason and Dr. Schuyler both produce some phenomenal work and have done a lot with my teeth. And so really do like trust that situation of being able to have an orthodontist and your dentist like in the same building. Not only is it convenient, but also the outcomes just seem to be like really amazing when we see them. So talk a little bit about just Jose and we understand every child at 1 year old is not going to love coming to the dentist. Like, and in general, children don't love the dentist. Now, our environment, our theming, all of that is set up so that it's supposed to calm the child. We have colors everywhere. We have, all these things going on. And I know you spoke a little bit to the environment, but I also know the opposite of that some of that can be really overwhelming for some of these kiddos with these sensory.
Yes, I think for us, it actually was, Jose loves, he loves going to the zoo. So I think there's like a crocodile that you guys have I'm thinking it's like the exit or no, not the exit.
In the game
it's
room.
in the, yes. Well, he's obsessed with that because I would think every time we go, he still wants to go back. Even when we're leaving the building, he wants to go back and
Is it the full size one? The one that's by the
video
games?
I think we have a picture somewhere where he's sitting on one. I can't remember, but he remembers that. He always wants to go back and visit that crocodile before we leave. So I think for us, it was very helpful. Even for my little 2-year-old, when she's gone in there, she likes to go visit the little fishies. And so it just kind of gives them who doesn't like to go to the aquarium or to, I feel like for my kids, it's really worked out. They really like it. They really like going in there, being able to kind of it doesn't look like you're going into a dentist office. You don't hear, your typical, it's different. It's nice. It's fun. The kids enjoy it. They walk in there and, they're not thinking dentist. They're thinking, oh, this is fun. Playing video games, looking at the little fishies. When they get their name called back there, and they're like, oh, okay, what's going on now? But I guess I forgot to mention too, Jose went from, not even letting himself do x-rays. So we could not get x-rays to save his life for the first 3-4 years because, sensory, he gags. If you put something in his mouth, he gags. But the last maybe 2-3, it's been 3 years now that he's done so well. He's gotten x-rays. Yeah. We were able to get x-rays on him. That's I was no way. He sat there. She was, she was very gentle with him because she knows he may just start gagging and want to start, throwing up here. But no, he didn't. She was gentle. They did x-rays, and that was big for me because I remember me sitting there holding him down because I really wanted x-rays done. I try to push to get stuff done just because for health wise, I want to make sure that they, if it needs to be done, that it can get done. So I do push for it. But when it can't get done, well, there's nothing but he did. Now he sits there by himself. I don't have to sit with him anymore. She's able to get x-rays. And that to me was big because from him going to where he would, that was the only part that he was nervous about. He would let himself get his teeth brushed, but for the x-rays, he didn't like that part very much because he would gag. But now he knows that, what's going to happen. He knows what he sits there, and they were able to get x-rays on all sides. And that was I think if you are a mom with special needs and you are in, a similar situation, you will understand that it's not always easy. And sometimes you don't want to push too much because you don't want to make the child or make them feel more uncomfortable, but don't give up. Just, try next time. And then just patience is one thing. And that's what I love is that you guys are so patient. If it can happen, at first I remember I'm like, can we try again? And she was like, yeah, we can try again. And because I would push for it. I really wanted the x-rays to be done. But then when I saw that it wasn't happening, I'm like, okay, we'll try next time. It's fine. But that's one thing that if they won't push you, no, we're trying. No, they were very patient and we're like, okay, if it doesn't work, we'll try next time. We'll figure out a way. And look at us now. I am not kidding you. We went, and I remember because we used to be put in a room. So I know that, Jose was probably a little screamer. So it was in a room and, it started, he's been going there for some time now, but when he was 1, 2, 3, 4, we were still in a room. He would wiggle a little bit, but now he's able to be out there with the other kids. I'm sure that in his chart there, it doesn't say he's screaming, kicker, he's biter because he did bite the first time. I'm sure that his chart now is he's a good kid because I can safely say I'll take my son to the dentist and I don't have to be standing by there holding his hand. I feel like he knows what gets done, and I'm so proud of him for that because with Jose, like I usually have to hold his hand, keep my eye on him, you know, like walk him through it. And now it's like he knows what's going to happen. He knows, you know, he knows what's expected. And it's from everything, every single time that we've gone there, you know, everything just going so well. Like he knows we get there, they call his name, they explain, hey, we're going to sit here. Hey, we're going to do this. Like, and that has done a tremendous change for us.
Yeah, I mean, that's awesome to hear. I know x-rays are really important for diagnostic reasons, so
Yes.
I know that's why you were pushing that. And I think what you're speaking to is going to hit a lot of parents, and just hopefully give, even if it just gives one parent like the courage to kind of, you know, take that step. I know that
Yes.
we see a lot of special needs patients all into adulthood. Like, I mean, we see a lot of older special needs patients. That's one of the reasons why pediatric dentists are considered specialists. They are, you know, we're highly trained to take care of special needs patients. I know we have some specific hygienists who have been super trained, like Whitney, and Whitney loves our special needs patients. She's so good with them. But also, like, as a staff as a whole, we do different types of trainings with like therapists and people who work with these kids on a daily basis, just trying to make sure that we're always informed on what are the best practices, what are the newest things we're doing. I know we had an interview with one of our hygienists a few months ago, Stephanie, and she really talked a lot about our special needs patients. And she mentioned to me that we actually will help out with like mouth props and like things like that you can take home to help with brushing.
Nice.
So
That's very helpful.
And then you also mentioned you mentioned like coming by for a tour, and we do have that up on our website now. So if any of you are watching this and you feel like maybe even if your child is not considered special needs, like any child, if you want to call up and you want to say, hey, I really just want to come by and just kind of see the place, let my kid kind of get acclimated, or maybe they're coming every 6 months and you want to do it at 3 months, just stop by and, you know, just see the practice again or remind them. That is totally open, and you can email us email us at any time, and we'll be happy to get those set up and get somebody to privately kind of walk you around. I think also that the advice you gave about bringing them when their other siblings are coming is super amazing, because we work on a like kind of a idea of show, tell, do. So meaning we're going to show them, we're going to tell them, and then we're going to do it. And so that is when they can also just see that happening without all of the, you know, hand holding or, you know,
Yes.
all of that has to go on. When they can see that it can be done in a calm manner, I think that's also very helpful for them. And we would be happy to do that for any family. So if you if you are interested in that, just reach out and we'll be happy to do that. I know that obviously your family has been very involved in our office for a really long time. We really appreciate you, you know, coming on here today and kind of letting our audience kind of hear it firsthand. I get on here all the time and talk, and we get the doctors on here and all that, but I think it's really nice to have a parent's perspective. So I appreciate you taking time out of your day for this.
No, thank you.
We really appreciate it.
Thank you for having me, and I hope that this helps any parent that's in the fear of either you're afraid to make that call to get your child in to get a dental checkup, but you know, it will definitely help to call pediatric dental and get that appointment scheduled and go step by step. You know, you'll get comfortable and you will be treated like you will not be treated anywhere else. So you definitely want to make that call. Don't be afraid to call, get it set up, bring your child in, and you'll see that they'll love their experience. And yes, I mean, I don't know if there's any other, I think that's what's worked for us, just taking, like I said, taking them consistently. And, you know, like you said, you're right. It's exactly what you guys do. Show, tell, do.
Yeah.
So.
Yeah, we try. All right. Well, thank you for coming on today. Thank you for everyone who is watching. We appreciate it. If you have any questions, please feel free to leave a comment below. You can also follow us on any of our social media by searching Smiles Are Wild. You can find us on Facebook, Instagram, and YouTube. We'll talk to you guys soon.